Did you know that the minute you cross hospital doors as a patient, you start losing your muscles? You lose about 2 to 3% of your muscle mass per day on a hospital bed. No wonder when you get home, especially if you're an older person with chronic medical conditions, your mobility is not the same. Moreover, some patients cannot walk at all. What is happening? That's what we're going to talk about today.
And in this video, we're going to give you 5 top tips to help you prevent muscle pain, muscle wastage, and subsequent deconditioning. And we're going to take this video to a place called Arundel, which is on the south coast of England, quaint, lovely village.
Deconditioning is a very common problem in our older patients after a hospital admission. What do we understand by deconditioning? It is weakening of your muscles, losing the muscle bulk, losing your stamina. After a week or two in hospital, you will be much weaker when you return home, and there has to be a good understanding of this by families and even social services. Because what I observe in my clinical practice is Doris, 92 years old, fit and well. She has quite a bad bout of pneumonia. She spends 2 weeks in hospital, and then pneumonia is treated. She gets back home, and the family expects her to do exactly the same things as she used to do before. But Doreen is not coping. She can't look after herself. She gets tired, and she might have a fall. And what happens? The families or care services, social care services, bring these patients back to hospital. They readmit them back to hospital, which is the last thing you need to do. Because what happens? They come back to hospital, back onto a hospital bed, no movement, and their muscles continue to waste away. So my tip number 1 today is, remember, it is inevitable. Deconditioning is inevitable in older, especially frailer older patients or in hospital. Expect when your mom or dad or your grandma, they come to hospital, back home from hospital, expect them to be weaker. It takes absolutely weeks for them to get back to their baseline, so you need to have enough social support, physiotherapy support, family support to get them back to their baseline. So how long should be their hospital admission? Of course, there are so many different medical conditions, and every medical condition will have different length of stay in hospital. What we need to understand is you need to get your elderly mom or grandma out of hospital as soon as possible. You must not allow them to stay a day over of what should be their hospital stay. Unfortunately, their discharges are delayed because of social circumstances, sometimes because of misunderstanding. On my geriatric wards, majority of medical problems are treated within 48-72 hours. If I could, I would have discharged most of my patients. Over 90% of my patients can be discharged home 72 hours later. Usually we give, for example, intravenous antibiotics for that length of time, and then they can carry on with oral antibiotics at home. But the discharges don't happen because there is either not enough social support, family support, or there is misunderstanding on how quickly grandma can get better. They get delayed in hospital, and of course that leads to deconditioning and all the hospital-acquired infections and all the problems which come with extended hospital stays in our elderly patients. So my tip number 2, please remember, majority of hospital stays for an acute illness in our frailer older patients shouldn't be more than 2, 3, maximum 5 days.
So my tip number 3 is to ensure that your parents, your grandparents are actually active at home. They're actually doing things for themselves. There is almost like a human instinct in us all that we want to help our older generation out. And to some extent, we can do that and we can keep doing it, but we have to ensure that we do get them to move. We do get them to kind of exercise on a regular basis. I mean, my mum had a stroke many years ago, and I still pull her out and take her on big walks, because again, it's all about maintaining that energy, that muscle mass, that strength, because you need it. You need that, and I'm sure you see that quite a lot in your patients. So tip number 4 is to know the medicines that may lead to muscle wastage or muscle pain. Now, there are two main classes of drugs which we know can do this. The first group is some drugs called statins. Now, statins are commonly prescribed by many of us. We're talking here a drug called simvastatin, atorvastatin, rosuvastatin. Very effective medicines, but in a very small number of people can actually lead to muscle pain and subsequent muscle damage. And the main tip here is if you are prescribed an antibiotic, try to not take your statin for the duration of the antibiotic. And the reason is there is interactions between them and certain types of antibiotics. So I know from you that seems to be the advice that you would normally be giving.
I would go as far as to say, do not take. You said try not to.
Yeah.
I would say do not take your statins while you're on antibiotics. Most likely your pharmacist will tell you this, or your primary care physician. But if they don't, just remember, while you are on antibiotics, do not take statins. Nothing will happen to you if you don't take statins for a week or two. But if you do, you increase the chance of interaction between antibiotics and statins, which are very common. You increase that chance, and subsequently you increase the chance of you experiencing side effects from the statins.
The other group of medicines commonly prescribed in an acute illness are the steroids used for ulcerative colitis, rheumatoid arthritis, COPD, but also used quite a lot for patients with COVID conditions. And we saw an increased use of steroids in that population. Now, they cause muscle weakness, leading to issues in long-term use. So one of the main tips here is to try and get away with the lowest dose you possibly can. So speak to your general physician. We call them GPs, but in America they're called
primary care physicians, PCPs.
PCPs. So try and get away with the lowest dose you can possibly get away with, but also maybe come off the drugs if possible at all.
Tip number 5. The tip number 5 is knowing about the medications which can strengthen your muscles. There aren't many, so I'm going to concentrate on vitamin D deficiency, which is particularly a big problem here in United Kingdom for obvious reasons. We don't get much sun here. And the vulnerable group of patients, which are our older patients, especially those who are in care home environments, or patients who have poor mobility and don't leave their houses, they will be at increased risk of vitamin D. And the blood levels should be checked on a regular basis, because there have been a number of clinical trials done which showed that vitamin D supplementation reduces the risk of falls and fractures, vitamin D supplementation with calcium. So it is important. My tip number 5, know your vitamin D levels, check your vitamin D levels regularly if you are someone who is vulnerable and at risk of vitamin D deficiency.
Before you go, what we did is we wanted to see what patients themselves felt of deconditioning. So we interviewed a gentleman, a lovely gentleman, while we were actually in Arundel, about his views and opinions about what the COVID pandemic has done to him in terms of deconditioning. So welcome to that video. It's going to come on next. Thank you.
So, when the castle opened, you said you got booked straight away.
Absolutely.
And it was mainly older people, wasn't it?
Mostly older people.
Why do you think that is?
I think because people like myself, the lockdown, well, as soon as things opened, we needed somewhere to go. We needed something to look forward to.
Yeah.
So that's
How did you cope with the lockdown?
I did cope, and we coped very well. I'm not paranoid, but I wear a mask when I've got to, and I'm very careful. But I must admit that this last lockdown has been very difficult, not only for myself, but for other people that I know of my age. We've all found it a little bit very difficult.
Why do you think that was?
I think we're starting to think now that we've got nothing to. We're starting to think that we had nothing to look forward to, and we've done all the hobbies and done all the excitement.
There's always so much puzzles you can do.
That's right. Yeah.
Oh dear.
Okay.
And how did you maintain your exercise levels?
I do, myself and my wife, we do lots and lots of walking, all right?